Yes. We are live. Thank you.
Okay, welcome to the special meeting tonight. And a roll call, please.
Yes, Councilmember Celeste Rodriguez,
Here.
Councilmember Hector A. Pacheco,
Present.
Councilmember Cindy Montanez,
Here.
Vice Mayor Mary Mendoza,
Present.
and Mayor Sylvia Ballin.
Present, we have a quorum. Madam City Clerk, would you lead us in the Pledge of Allegiance?
Yes, I sure will, my honor. Please stand. And place your right hand over your heart. And I will begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. Is there a motion to approve the agenda?
Motion to approve.
Is there a second?
No second.
Roll call, please.
Councilmember Rodriguez,
Yes.
Councilmember Pacheco,
Yes.
Councilmember Montanez,
Yes.
Vice Mayor Mendoza,
Yes.
and Mayor Ballin.
Yes, the motion passes. At this point, we are on administrative reports. Mr. Manager, please present the staff report.
Will do. And before we go to that, Madam Clerk, were there any public comments that were submitted today for prior to the agenda?
Thank you. No, there were no comments submitted today.
Okay,
And
we don't-
actually, we have up until 5:15.
okay,
So I will keep an eye out on my
Sure.
email.
so if any, I'll give a presentation. If we just, please feel free to let me know at the end of the presentation if anyone has called in or sent an email.
Okay,
Thank you.
thank you so much.
Okay, thank you, Mayor, members of the City Council for coming together tonight for this special meeting of the City Council. It's a timely meeting because I wanted to discuss some potential legislative advocacy efforts, increased legislative advocacy efforts, supporting local residents' access to COVID-19 vaccinations. Particularly in light of some of the opening of a few sectors that are eligible. However, there's still quite a few residents in San Fernando that are having, trouble accessing vaccinations that aren't necessarily in any of the eligible categories yet. So I'm going to go through the staff report relatively quickly. On February 22nd, the LA County Department of Public Health announced the additional sectors of Phase 1B, Tier 1, which includes education and childcare, emergency services and first responders, and food and agricultural workers would become eligible to be vaccinated in LA County effective March 1st, 2021. So again, that is in addition to all healthcare workers and all residents age 65 and plus. So subsequent to March, so as of March 1st in LA County, if you are over the age 65 or older, and if you are a healthcare worker, an education or childcare worker, emergency services or first responder worker, or a food and agricultural worker, which includes grocery store workers, you are eligible to receive the vaccine, or you are eligible to make an appointment for a vaccine. If you are not in one of those categories, you are not yet eligible. So on March 3rd, which was just last Wednesday, city staff received a notification from a state agency that the city of San Fernando could request what's called single-use health equity codes, vaccination codes, that would be provided to various groups of underserved and vulnerable populations, including Black, Indigenous, and people of color, which includes Latino person, Latinx persons, as well as persons with developmental and other disabilities. It was staff's understanding at the time through both the email and a verbal confirmation with staff members at the state agency that reached out that those codes were available to individuals age 18 or over, regardless of their occupation or immigration status. And we needed to act quickly as codes needed to be requested by March 5th, which was last Friday. So staff did work quickly to put together a registration portal, allowing residents to provide their contact information and receive and request to receive one of these codes. On March 4th, that portal went live, and it was distributed to all of our residents that had signed up to the city's email notification system through Constant Contact, which was about 5,000 individuals. The next day, so on Friday, March 5th, staff was contacted and notified by the state that there had been a miscommunication in the appropriate use for these vaccination codes, and indicated that the city may not be eligible to receive codes. In particular, when I say the state, this was now Cal OES, Office of Emergency Services. They said that those codes were intended for community-based organizations and not cities. And so over the weekend, I wanted to confirm we did not receive any vaccinations from the state. So as of the writing report, we have not received any vaccination codes from the state. And I did confirm today. I reached out to the staff member at Cal OES that I've been working with. She's a deputy director, and asked her, just to confirm. And she did confirm that those codes they have been distributed to community-based organizations, faith-based organizations, small organizations like that, as opposed to that they had been working with for the last month or so, and they weren't made available to cities. And I asked her about the state also last Thursday announced this equity framework, which was a strategy to allocate more vaccinations to certain to the lowest quartile of what's called an HPI or health. It's a healthy cities index that's being used. So that strategy allocates more vaccines to those areas, but it still requires that you meet the current eligibility codes. It does not lift sort of the what the current eligibility is. So that's where the state is today. On Monday, we did send out a note to all of those folks that did register, letting them know that we have not yet received those codes from the state, and unless there's sort of a change in policy, we may not receive codes in the near future. That being said, we did want to get together and kind of build on this. I wanted to share with council how many people did actually respond, how many residents responded, and maybe we can use this as a point to enhance our legislative advocacy effort and really try to start to really leverage this to kind of continue to influence policy. So 93% of San Fernando residents do identify as Latinx. And according to the county's own COVID-19 data, we do have the highest COVID case rate per 100,000 residents of any incorporated city in Los Angeles County. There are a few areas of the county that have a higher case rate per 100,000, but we are the highest incorporated city in Los Angeles County. Additionally, according to the vaccine data provided, and this is as of February 20th, so it's probably about 2.5 weeks old at this point, but as of February 20th, there were about 2,224 persons from San Fernando that had received at least one dose of the vaccine. That's 10%. That's less than 10% of our residents, when you compare it to our most recent census data. If you just take the average of the data that was provided for each community by the County of LA, that's below sort of the average. We're not necessarily the lowest, but we're definitely below the average for vaccination rates. There's in the staff report, there is a table that outlines some of the responses that we got during that initial email outreach. I do want to note that as of Friday, when we received the message from the state that there may have been a miscommunication from the agency that initially said that we would be eligible for these codes. We didn't necessarily shut down the registration, but we put a note on there saying that, we may not receive codes, but if you want to register, to make sure you receive information if anything becomes available, to continue to register. So through the weekend, we got a total of 1,922 registrants. We had about a little under 1,300 as of noon on Friday. So we got an additional, say, 600 over the weekend. Of those registrants, 1,172 gave a San Fernando address. And there was an average of, we asked people how many people in their household they would request codes for. So there was an average of about 3 codes per household. So, you're looking at about 3,376 codes requested for San Fernando residents. And then we just listed, there were some requests that were from neighboring communities. So we also broke it down for each one of those communities. And then we had to check a box if you were identified as Black, Indigenous, or a person of color, which was one of the eligibility criteria that we were operating under the assumption that was the criteria. And we had just under 70% had checked that box of San Fernando residents. So clearly in a pretty short amount of time, there's a pretty significant response received, which just illustrates how eager, San Fernando residents are to secure vaccination appointments. So one of the things that I think that and came up from other council members is, okay, so what can we do to influence, to build on this and influence, continue to try to influence policy. Some of the legislative advocacy efforts and partnerships that we've already engaged in since the COVID vaccine has become available in Los Angeles County is we did work with the city of LA and the LAFD to provide a vaccination site at San Fernando Recreation Park. We did submit a letter, the city council submitted a letter to LA County Supervisor Sheila Kuehl requesting additional vaccination resources for the San Fernando community. This was probably a little less than a month ago now. And then we've worked with local healthcare providers, including Providence, LA Care, San Fernando Community Hospital, and even Cal OES we're working with them to try to get some mobile pop-up clinics at some of our senior locations in town. So we really, again, to try to establish some mobile or pop-up vaccination clinics in or near the city of San Fernando. So we've been working, and it's been a smaller scale because, obviously we have a limited number of persons in San Fernando that are eligible per the county's current guidelines, but we are trying to provide a number of different resources to get those vaccinations to people. Again, despite these efforts from and support from other local elected officials, our COVID vaccination rate continues to be less than the average compared to other communities. So one of the things that came up out of this, the data collection over the weekend, and unfortunately, the miscommunication, but has led to, us being, very aware of what of the state's current policies. The city may engage and look to engage in leading in additional legislative advocacy and outreach activities, in encouraging local constituents to be more proactive in weighing in on the state's vaccination policies. Some examples, and obviously this is what we're here tonight to get some feedback from council on activities they would like staff to engage in. But some activities include supporting a letter writing campaign to Governor Newsom's office, which would really, we could draft sort of a sample letter that interested community members might want to use, or that they could submit to the governor's office that we're commenting on their current policy. We could create an online petition to be signed by Northeast Valley residents, San Fernando residents, Northeast Valley residents, and requesting more additional resources, and submit that to the governor's office, and really just kind of leveraging the city's communication channels through social media, Alert San Fernando, Constant Contact, etc., to provide materials and legislative advocacy materials to the public, so to help them with their outreach to really try to impact and sway policy decisions up in Sacramento. So that is the, I do want to put out there that, right now the state of California's policies and actions to get vaccinations to the most vulnerable populations are continuously evolving. It's really like a week to week, not even week to week. Sometimes it's day to day. In the city doesn't get a lot of heads up, but what we really are trying to do is when there is an opportunity, even if it's a small opportunity, or a small crack that we may be able to assist our residents. At City Council's directions, we're trying to jump at those opportunities, and sometimes that may result in kind of the miscommunication that happened here. However, I think there are a couple things that we can, like a sort of a happy accident out of that is that we got a lot of contact information. We got some good data on how many people are interested, a small sample size, albeit, but some good data on who's interested in San Fernando and getting the vaccine. We now have a good direct channel that when things do become available on a wider scale, we can quickly get that information out to people we know are interested because they already registered. And we can encourage them, if council would like, we can encourage them to get involved in the policy discussion and sort of use their voice to really try to work with, to kind of add their voice to the city institution's voice to kind of advocate for them for all of us up in Sacramento. So that's all I have for a presentation tonight, and I'm very interested in City Council's feedback and direction on this particular item.
Thank you very much. I'd like to go to Councilmember Rodriguez.
Thank you, Mayor. I just want to start with, well, one, thank you all. I know this was super short notice for a meeting, and I know everyone's really passionate about getting these resources to the community. So I'm happy we could all get together. I think with anything on council, we're going to be stronger with a united message. So I think it's great that we can come together today and plan what this advocacy effort looks like. I also, Nick, I know that you've been working on this vaccine like task force amongst staff, and I think the way that you were able to jump in and seize this opportunity just shows how great that plan is, and you're really working to connect our community to any resource that comes up. So I just want to recognize that. Also, I want to just emphasize, right, that I think Nick, you've been very gentle in your staff report and your update about kind of these misunderstandings and assumptions, and I think I imagine I share with many of you frustration with the fact that, it was really exciting to hear that we had this resource for our community. We all advocated for this, and it seemed like a response to our advocacy efforts. And then simply the state offered something and is now not giving it to our community. And I think that's the part that really upsets me and really upsets our residents, especially those 2,000 households representing 5,000 family members who are in desperation to protect their health and the health of their family. So I just really am hoping that we could take this, at least personally, right? I was upset, and immediately I thought we should make noise. We should get every one of our residents to raise their voice and say this was not okay, and it is not okay, and we need this resource. And together, I think if we step into this as the city of San Fernando and as council members and do all of the things that Nick mentioned, right? Combined letter campaign, an online petition, even offering people phone numbers that they can call and advocate, and maybe a script, Nick, right? All of those basic advocacy like plans. Even, I'm grateful that we have this way of reaching a lot of people at once through the email blast, but there are a lot of people we're not reaching. And so I think we also really need to consider postcards that let people know how they can get involved in this effort, but also letting them know about the resources that we might not be communicating effectively just through our social media and even our text efforts, because it reaches so far, but there's definitely way more people that we want to let know. I wanted to ask a clarifying question first, Nick. So first, if this opportunity was intended for community-based organizations, could we then still take advantage of this opportunity and connect a local CBO to receive the codes? Because I already know of one that would be happy to jump in.
Yes. Yeah, we can definitely connect community-based organizations. That being said, the biggest part of the miscommunication is that Latinx by itself was or Black or Indigenous, your ethnic makeup was by itself a qualifier regardless of age. That even if we connect with community-based organizations, I do believe there are some local ones that are working with the state. It still would be only for people that are 65 plus, work in those occupations that are eligible, which again is still a good number of people. But that's the qualifier there.
So I mean, then, so there's still something we can do then, right? With at least getting codes to maybe if anyone signed up their grandmother in their household.
Yeah, and so from what I understand, they were a week-to-week basis that they were providing these codes. So, so maybe next week if we get a community-based organization that's in the pipeline that has these outreach capabilities for their customers or their clientele, we can put them in connection with Cal OES, and they may be able to then request those codes for their constituency that's in San Fernando.
Got it. Yeah, I think with any of these things, like I think we're at a point that we should really just we should insist. And then the new equity plan, I think you had mentioned previously, and I don't know if you have any more updates about what would be included in this new vaccine equity plan rolled out by the state.
Yeah, so that actually was just something that was announced last Thursday by Cal OES, and actually the person that I was going wasn't even very familiar with it. But she did mention that that the strategy would be about how vaccines are allocated. So they allocate more doses to quote unquote zip codes that are in the lowest quartile of HPI stack. But again, I don't know what that, there's not a lot of clarity of what that means. Like you can allocate all the doses you want, but if there aren't people from those zip codes that are signing up, or if they don't even have a place to go, I don't know how effective that sort of equity framework will be. So there's still a lot of, I think there's still a lot of questions surrounding whether or not, how, even if those zip codes have been allocated more vaccines, again, they would still have to qualify based on occupation and age. How are you then, what's the step to actually get those people in to get shots if there are very few vaccine resources in that area. So there are definitely questions surrounding that equity framework that I need to continue to follow up with.
It would be great, I think, for all of us to get updates on that,
Yeah.
Especially as we keep contributing ideas to how we can advocate. Because if there's, if anything we've learned from this, right, it's that we have a low vaccination rate in our city, not because people aren't wanting them, they simply don't have access to them. And I think, it'd be interesting to look at how many people we have helped vaccinate in our city using our city resources and our city facilities, and drawing that comparison, right? The fact that we're predominantly a community of color, we're vaccinating the entire region, and yet we still have a super high case rate and our community members are getting sick and vaccinated and don't have any opportunities, and the state is, offering things and then taking it back. So it would just definitely be great to learn more about those details as we move forward. And then do you know how many people we've assisted in vaccinating?
I don't know that off the top.
Okay.
We'll meet with staff this week and get that information.
Okay. I think with all of our efforts, I think that's part of the narrative, right? We've really stepped forward. We're really contributing to this cause and we need help. Our whole region needs help. Pacoima, Mission Hills, Arleta, Silmar all showed up on that list. And so I also am wondering, from what I understand, you've been working with Luz Rivas. Have you also been working with Hertzberg, or what's the state coordination with our local officials like?
No, I've definitely had a few conversations with Luz Rivas' office. I've also kind of reached out and had a few little back and forth with Hertzberg's office, but we'll reach out a little. We'll continue that outreach with both elected representatives. Assemblymember Rivas obviously is very much supportive of, and is also trying her best to get more resources in this area. So
definitely. And I think if she's part of this effort, and we could put even her office number on there for people to call, then, that just gives her more backing to go advocate on her behalf when tons of people are calling her office. The last suggestion I have right now is just that we leverage our local newspapers and potentially write op-eds for the papers to again, like shed more light on specifically the situation and the overall need in our community. And with that, that concludes my comments right now, Madam Mayor. Thank you so much.
Thank you very much. Councilmember Pacheco?
Thank you, Mayor. Thank you for your presentation, Mr. Kimball. Obviously, we're experiencing a little bit of the same old story that we've had, since the pandemic hit. Communities like our own that have lower income, people of color, we're at higher risk of contracting COVID, and all the vaccination numbers look like we are getting vaccinated at the lowest rate of anyone. And so, frankly, it's unsurprising, but as elected officials, we're here to strive for better and strive for more. This is a special meeting, so I'm not really going to go into, the whole spiel about, where we're at and the kind of hand that we've been dealt, so to speak. But I did want to touch on a couple things. Councilwoman Rodriguez, to your question about, I think, the percentage or number of vaccinated, last I looked today, it was less than 20%. So I think we're still below, 4,000 folks vaccinated. And secondly, echoing your point on these codes being for CBOs and faith-based organizations. If that is the case, we have plenty of those here in San Fernando, right? So I definitely want to echo that sentiment of let us know what we need to do in order to identify eligible organizations that can, in fact, receive vaccine or whatever it is. We are absolutely here to help, and we're here to do much more than we can. I am also concerned about City of San Fernando's management situation. However, since we are losing Mr. Tim Howe, who has been pretty much the point man on everything COVID. And so could you speak a little bit as to what we need to know in terms of our service and our manpower and what we need to prepare for upon his departure?
It's something that I think in every organization, we always need to kind of deal with any employee that, and again, congratulations to Tim. He will be moving on to different opportunities. So in the next week and a half or so. But we do have a really capable staff, management staff, and even Tim's folks in community development, especially the code enforcement folks, and are really dedicated and on top of a lot of these a lot of the new orders as they come out. So in my office, Julie Fernandez has been, so she's been the critical to actually updating. She updates the website. She's updating a lot of the presentations that Tim puts together, and she updates a lot of the information in the staff report every 2 weeks. So we have had multiple employees that are involved in this COVID response effort, especially a few over in the police department. So we're all going to just need to kind of take our piece that we've already been working with and just expand that a little bit further than what we've been doing. But I'm very confident that it's not going to impact our response effort. Tim obviously did a really excellent job, but he's not the only one that was working on it. We've had multiple staff members that have been working very closely and on a daily basis updating. The whole vaccine task force of 5 or 6 of our management have all been working on every aspect of COVID response. So we'll have one less person on that task force, but we'll continue to be able to get our voice out there and work toward adequate response effort.
Okay, that's reassuring. And to be clear, as far as the eligibility, in our current tier, it includes grocery workers and everyone related in food service that isn't at home, right? Like catering companies and restaurateurs and people that work at restaurants, etc. Is that the info you have as well?
So the info I have, and I'll have to look at the restaurant people that work at a restaurant. I know that it's food and agriculture, which includes grocery stores. I believe, restaurant people that work in restaurants are more, food prep and service industry. Tim, from your end, off the top of your head, is that, are you aware if people that work in restaurants or food service are also eligible? I can look that up as soon as we get off and have a better answer for you.
No, it's mainly food and agriculture. So if you're tied in with those, which also does include grocery store workers, yes. Food services, not at this time.
Okay. I must be mistaken then. Otherwise, I guess let's just continue doing what we can. We're here to help, and if there's anything that that our colleagues, please throw all the ideas out there. Obviously, we're trying to make something work. So, but I'll yield my time. And Mayor, if there's anything that comes up, I could just raise my hand and ask for a bit more time. But that'll conclude my comments for now. Thank you.
Thank you very much. Councilmember Montanez?
Okay. The governor, has called equity his North Star. Well, I think he and his administration need to come down south to see the suffering that our communities are going through. It is unacceptable, complete injustice, and from my opinion, inhumane for the governor's administration to turn their backs on the people of San Fernando. It's short-sighted, and it's a sign of a bureaucracy that is completely disconnected from the realities of regular people, especially people of color, who have been allowed to get infected. We've gotten sick. We have died literally by the thousands of people. And unlike the Bay Area and big cities and all these wealthy communities, we don't have large nonprofits that can spend literally hundreds of thousands of dollars to put together an outreach effort the way a small city can. They have no idea that it's actually the city of San Fernando that has the most direct contact with San Fernando residents. And it's the city of San Fernando, as we have proven from the very beginning, that has the abilities to send text messages, to send emails, phone calls, knock on doors, go to the senior centers to talk to our residents. Because most of our nonprofits are really small and they don't have a database of 5,000 plus San Fernando residents. So I'm sorry, it's offensive for this administration and all these administrations to say to Latino and Black communities that we're scared to take the vaccine. When we proved in San Fernando that within 24 hours, we had almost 20% of our population that signed up to say, give me the vaccine. So we don't need any more campaign slogans. We don't need their damn apology for turning their back on our community. And we sure as heck don't need any more newspaper headlines talking about how unjust the vaccine rollout has been and how we as Latinos or Blacks are afraid to get the vaccine. I'm sorry, we don't need any of that. We need the vaccine, period. We have had the worst rate case from the very beginning. We today, 2 days after they deny us what we are entitled to, which is the vaccines, they turn our backs on us. We set up test sites. We opened up vaccine sites. We know 45,000 vaccines have been given right here in our poor neighborhood, a community that has the worst rate case and has had from the very beginning. And they turn around and they ignore us. There's 38 million people in the state of California, and they can't send 2,500 vaccines. How dare they? How dare they literally dangle a lifesaver before us on Friday and turn around and let us, and they turn around, they walk away, and they're letting us drown. So I don't know about this council, but enough is enough. And I think that we absolutely get on the phone. We demand a meeting with the governor. We talk to the head of Cal OES. We talk to the supervisor, to our assembly member, to our senator, and we are done. We are done being made fun of. There's no way in heck that they would have done this to a wealthy white community. So no wonder people are upset at this administration in the state of California. No wonder, because they are so disconnected from what's going on. So I think that we do nothing more but hound them, because our community deserves to live. Enough is enough. We have done everything that we have been asked to do. And all that needs to happen, the vaccine site right now, if they deliver us those 2,500 vaccines, we will improve their pathetic numbers. Pathetic that they have only vaccinated single digits of Latinos and African Americans. I'm sorry. We have a solution. We have people. We have a vaccination site. And the only thing that's stopping us is racism. The only thing stopping this is an injustice. The only thing stopping people from literally living and not being infected is an administration that's disconnected, and enough is enough. So yes, we have a lot to do, and absolutely we should be on the phone calling them and demanding that they give us the vaccine and nothing else. We don't want anything else. We want the vaccine to save people, period. So I am happy to call the governor directly, their chief of staff, our legislators. I've been there. I know how that stuff works. They ignore you if you don't speak up. So yes, San Fernando, it's time for us to speak up, because it's 12 months. It is 12 months since my mom got infected. It's 12 months since she pushed and pushed to get off that ventilator. And it's 12 months where we have seen our neighbors, our relatives, our families die. My neighbor just literally a few days ago died. She didn't deserve to die. But again, they dangle these vaccines. They've ignored us. And so I've had it. I mean, I will drive to Sacramento tomorrow, and I will sit outside of that door until they take my phone call, they take a meeting, and they actually begin to listen to us and respond. 38 million people, and they could not give 2,500 vaccine. That's an insult. So yes, Madam Mayor, I think we do everything that we absolutely can. And it starts by going directly to the top, because we've had it.
Thank you very much. Vice Mayor?
Thank you. Yes, I support what our council members have said there, and we do need to stop the injustice that's going on in the city of San Fernando with the COVID vaccines. And I support that we, talk to the governor, set up the meetings. I think that we need to start our own protest and see what we can do. Thank you, Nick and the and staff for everything you've done. You've done everything you possibly could, reaching out to everyone and all of us, keeping us informed. It's a big task, and I know that you've done everything you can. So we've said sending a letters, doing a campaign on that. If you could provide us with those, for those that are listening, Nick, possibly the address. You can provide that right now, the address and phone number, so people can start writing their letters if they wish. I think we also need to do more of an outreach to our community, also in educating them about the vaccine. And maybe we can talk more. Can some of those organizations gather and make like one big organization, and so that we can get those access codes? Nick, is that a possibility? Pull our resources together.
Yeah, I mean, obviously there's two paths, right? I mean, we can kind of work through the system, and we'll continue to do that. Which, you know, I think that's kind of
no. I mean,
Yeah.
I'm sorry, you guys. I don't want to continue to accommodate them. I'm sorry. There's no other organization in San Fernando that can get to San Fernando residents the way the city of San Fernando can. We're not the big fancy San Francisco. I'm sorry, we're not. And we're not the city of Los Angeles. We are the city of San Fernando. There's 25,000 of us. We as a city have access. They need to go through the city because that's the best way to do it. All of this time, by the time we get all these nonprofits together, more people are going to die. More people are going to get infected. We have a list and we'll get more people. So I think we just go straight to them and say, Sanford, we have a list. Give these people their vaccine. Period. And they need to listen to us. We know better. They don't know. Clearly they don't know. They're screwing it all up. I mean, we're trying to help here. You know, maybe we could save people and keep them in the administration if they actually, you know, start helping out Latinos and African Americans and people of color and poor people. So they should just go through us. No, I don't think we should go. I mean, I know what you're saying, Vice Mayor, but you know, that's going to take a long time. I mean,
You're right.
I run a big nonprofit, you know, over $10 million a year. I can't put together a vaccine, you know, program. San Fernando can. We already have it. Why are they making us go more bureaucracy? Let them, you know, continue with their messed up bureaucracy and let us do the way we know how to do things in small cities. We're efficient. Just send it to give the people on our list the vaccine. It's that simple, and we'll get you more.
That's all I have. Thank you.
Thank you very much. Is there any other council member that has anything they would like to add? Okay, Nick, this is what I feel we need to do. I'll get to you in a minute, Councilmember Pacheco. I do agree with every one of the council members, but there isn't time, as Councilmember Montanez said, there just isn't time for us to go to all these various organizations to write the letters, to develop and to kind of make things go happen in a coordinated effort with our nonprofits, our churches, and what have you. It really falls on us, on the city council, on the city of San Fernando. And we need, number one, a very strong letter written to the various electeds. In addition to that, I feel very strongly that each of us should take the time to call up the governor personally, call up and you need to give us the list, Nick, and the phone numbers, who we should call, because they need to hear from each of us. Not only do they need to hear from each of us, they need to hear from you, Nick, and they need to hear from Tim, and they need to hear from Matt, and they need to hear from our executive management, SEIU. Have them call as well, who represent the POA president, have them call. Our community needs our voice now. As Councilmember Martinez said, there have been far too many deaths in just a month in the city of San Fernando. I know of at least 10 people that have passed away that are we were close to. My husband and I were very close to. That's just me. So, but I think that that's the action we need to take. And I'd actually like to engage Rick Law Firm and have Rick's law firm send a letter as well. Richard, got that? I think it is important.
Already texted him.
Okay, good, because they need to hear from the chief. We need the chief to send, to make phone calls. And I think it falls within our responsibility as the electeds to reach out. And I wanted to say one last thing before I go to Pacheco, and then I'll go to you, Councilmember Rodriguez. The governor's office did reach out to me and is concerned, but I definitely need to follow through with Vanessa. I wanted to have this meeting, and I will give her a call back and let her know how desperate we are. We're trying to save our children. We're trying to save our parents, our sisters, our brothers, our mothers, and our daughters. Because as you said, your mother, which she went through quite a bit, my family members have gone through. Until you see it, feel it, touch it, and see how devastating it is to a family, you just cannot, it's hard to relate to it. You just hear about, oh, people die. It's not that simple. It's not that simple kind of a death. So I can relate to what you're saying. And Councilmember Pacheco, I'm calling on you.
Thank you. To staff, Mr. Kimball, if you could circulate that short list of folks and their phone numbers, like the mayor and like the council has alluded to, of who we can begin calling tomorrow morning, right? I mean, as long as there's some kind of coordinated effort, I think that would be most effective. Secondly, I think the mayor is right. I think we should have every maybe department head enlisted in calling as well from all of our departments. I think all of them are in one way or another related to healthcare and health equity, right? And I think either in our individual capacities or as a city council, we can also ask the union representatives that work in the city of San Fernando, because their workers and their union are also impacted by this. So if we can just get that info to the city council members specifically as soon as possible as well, just to know. I mean, I know we already have it, but just, a short list of the ones that either you've been in contact with, or the ones that are ducking your calls, or the ones that are actually just most involved with the action of dispersing, the vaccine, from the governor all the way down to, the folks who gave you this incorrect information. Maybe it's 5 names, maybe it's 10 names, whatever it is, just phone numbers and emails. And then I like echoing what the mayor said. I think it really is on us, city council, to just put gas pedal here and continue with that. So thank you, Mayor.
Thank you. Councilmember Rodriguez.
Thank you, Madam Mayor. I just, obviously, I completely agree with everyone. I do want to say, though, I don't think it's an either or sort of thing. I think that we can simultaneously, as council members, advocate on our community's behalf and empower our community members to advocate on their own behalf. I think a bigger voice is a stronger voice, and it can lead to more action, and it doesn't have to be one or the other. And I think, Nick, it's up to you to relay to us if you're having any sort of capacity challenges. But I think giving people the tools, letting them know what they can say, letting them know who to call, letting them know how to write the letter, I think all of that can happen at the same time that we're advocating on their behalf as well. And so I also want to mention that I agree, if we can't lift up a huge nonprofit collaborative right now to do this. But if our existing nonprofits simply need a connection to this resource to help start to distribute this code for those that are vulnerable and part of the list that they had intended, then we should do it. Again, simultaneously. We demand more vaccines for our community, but we also make sure that we're flipping over every rock and connecting every dot that we can to make sure people are getting vaccinated right now. And so I just want to mention that it's just, we should just do it all. Our community deserves it. And I'd like to make the motion to have Nick have all of our blessing to move forward with a robust and aggressive advocacy effort to get vaccines to our community.
Yeah, and I would just add that the letter be sent over to our assembly member and our state senator, so both Luz Rivas and Bob Hertzberg, and have them sign the letter with us.
Yeah, I have another idea as well. We all sit on various boards, and I think we need those boards to support us as well. So we can somehow get them on board to send a letter of support for our community that is the hardest hit. we have most of our community members are essential workers. So if there's some way, and I'll certainly with ICFA, I'll ask if a letter could be drafted and sent on our behalf, and they can express their concern for exactly as the minority community that we are, as well as having the highest rate of COVID. So I think we need to add that into the motion as well for the boards that we belong to. And with that, is there a second to the motion?
Yeah, and I'll second, Mayor.
Okay, roll call, please.
Councilmember Celeste Rodriguez,
Yes.
Councilmember Pacheco. Oh, I'm sorry, you're on mute. Councilmember Rodriguez,
Yes.
thank you. Councilmember Pacheco,
Yes.
Councilmember Montanez,
Yes.
Vice Mayor Mary Mendoza,
Yes.
and Mayor Sylvia Bowlen.
Yes, for using every tool we have in our toolbox. Absolutely. And with that, the motion passes. Thank you all very much. One of the most important motions that we will have passed as council members, one of the most important, we're saving lives. The next item is staff communication, including commission updates.
I do not believe there will be any staff communication tonight unless any of the department heads want to unmute and chime in, but we'll save that for our council meeting on Monday night.
Okay, and I believe that the general council comments and board updates should also be saved for Monday night. Nick, isn't that, we just do the special meeting as the specific item and not?
Yeah, that would be my recommendation, just because most
Okay.
people are used to hearing it on those on our regular nights. So.
Okay, and with that, I officially adjourn the meeting. I'd like to thank everybody for participating at the last minute.
Yes, thank you. Staff will get on that direction
Thank you.
immediately, if not sooner. So thank you.
Yeah,
Okay,
really
thank you so
appreciate
much.
this meeting, Madam Mayor, really. Thank you.
Thank you very much.
Okay.